we're recording. Great. This is just, again, quickly what we're going to cover this evening. Going through we've done our introductions, going to go through some background, have a look at the network's website and the resources, look at what the objectives of this online network is, and then hopefully have some time for sharing. And then at 8:30, that's kind of officially the end, but I'll stay around for half an hour or so. And if people want to stay, have a chat, go into breakout rooms, ask questions, whatever, and then we can do that. And people will find that helpful. So great to see lots of people are already introducing themselves on Jamboard, and we'll have a look at that in a minute. So just firstly to introduce the Centre for Sustainable Healthcare for those of you who don't know who we are. So CSH is a charity that was established in 2008, so has been going for a very long time. The sort of founding members of CSH are really experts in the field. The organisation has really expanded quite significantly, particularly in the last few years. I've joined just in the last 6 or 7 months, and I'm sort of the first pharmacy professional working for the organisation. So I guess the vision of the organisation is to inspire and empower people to integrate sustainability into healthcare. So we're really about learning about how we can be more sustainable in our provision of healthcare and how we can sort of share and spread that practice. So there's a few key pieces of work and tools and frameworks that CSH have produced, and it's really worth having a look at these if you're not familiar with them. So the first are the principles of sustainable clinical practice, and they're there on that infographic for you, listed in order of importance and impact. So number one being prevention, so trying to promote health and prevent disease in the first place, and tackling the causes of illnesses and inequalities. And for those who already have illnesses, sort of preventing worsening, preventing exacerbations. Second is patient self-care, and this is really around empowering patients to have more agency in their own healthcare and their own health and well-being. So certainly in the UK, we're very focused on person-centred care and shared decision-making, and so hopefully that'll be familiar concepts to you all. Number three, lean service delivery. So this is really looking at streamlining processes, and this can apply to anything, stripping out waste and some sort of minimizing waste generally. And then finally, low carbon alternatives. So looking at things that have a lower impact on the environment. So inhalers and anesthetics are obvious examples at the moment. But I think it's interesting to just remember that those sort of low carbon alternatives are way down the list, and the prevention and empowerment are much higher up and much more broadly effective and have much more long-term effects. So the QR code there will take you to the CSH website. So as well as being able to see the information about the principles, you can also see information about the various courses that we run. We have a whole range of courses, foundation courses, right up to sort of board level courses. So there's lots of information on the website if that's something that you or your organisation is interested in. SUSQI framework is one of the key outputs for Centre for Sustainable Healthcare. So QI being quality improvement, and SUSQI being sustainable quality improvement. So looking at how you can incorporate sustainability into existing QI frameworks and into existing sort of QI programs. So again, this is a really neat little framework that you can sort of fit into QI work that you're already doing. And I would certainly recommend that if you haven't looked at this, that you go to the website. Again, the QR code is there. There's a really helpful sort of step-by-step guide to the SUSQI sort of process. And the key issues or the key sort of things with the SUSQI is firstly, we look not just at outcomes for individual patients, but also outcomes for the population as a whole. And then secondly, we look at the triple bottom line. So instead of just looking at financial or maybe cost-effective sort of outcomes, we're also looking at environmental impacts and also social impact. So it broadens people's view of what they're doing, and gives them a framework to look at, well, how does what we're doing around, for example, reducing medicines waste, or, you know, making RRP prescribing systems more efficient, what environmental impacts do they have? What social impacts do they have in terms of patient well-being, patient convenience, staff engagement, and there's a whole range of things. So again, really useful resources on the website, it takes you through step by step, and there's lots of templates on there that you can use to help you with that process. So one of the little tools that we use is one of these, which is called a driver diagram. And this is a really great tool to use with your team if you want to sort of brainstorm ideas, or you're thinking, well, what can I do in my line of work, or sort of my particular department or my area that I work in. And this diagram just helps you to break it down. So looking at our sort of overall outcome to reduce carbon but maintain high quality care, and looking at reducing activity and reducing the impact of activity. So you can think about each one of these aspects and sort of break down what you do in your role and link it back to each of the individual principles. So it's a really good way to help people sort of think about what they're doing in their day-to-day role and what they might be able to do to make a difference in terms of sustainability. So in this example, I've just linked the Royal Pharmaceutical Society sustainability policies. So in the UK, the Royal Pharmaceutical Society declared a climate emergency a few years ago and have developed some sustainability policies and are currently in the process of generating a green plan for community pharmacy and hospital pharmacy. So lots of work going on there, which is great. But you can see that their sort of key policies link back really nicely to the principles of sustainable healthcare. So that's just one example. You can apply it to your own area of work. And again, if you go to the SUSQI website, you can download a blank copy of the driver diagram and then use that in your own sort of team meetings or whatever. So of course, the reason we're all here today is for the Pharmacy Sustainability Network. I've put the QR code here. So great that you've all joined us. So I know that everybody who's registered for tonight's meeting is not in the Pharmacy Sustainability Network, and there's a couple of steps. So the first step is you join the network hub, and then you're a member of our general network hub, and you automatically get signed up to the Sustainable Healthcare General Network, but you then have to log in and specifically join the Pharmacy Sustainability Network. So I'm going to put the links in the chat box in a minute when I've stopped sharing slides, but you can scan that QR code if you wish, and I'm going to just take you to the website in a moment and sort of talk you through each of those things so you can see what it looks like actually on the website. Okay. So just to sort of briefly talk about our objectives of the network, the main aim of this network is to connect all of the sectors of pharmacy and pharmaceutical science and encourage discussion, sharing and dissemination of knowledge and experience relating to sustainable pharmacy practice and education. So we're really hoping to sort of bring together a group of pharmacy professionals, students, people who are interested in pharmacy, anybody really from around the world to kind of come together as a community and share what they're doing and sort of support each other in this work as we move forward. Certainly in the UK, we know that medicines account for 25% of the NHS carbon footprint. So I think it's really clear that the pharmacy profession and pharmacy teams have a really critical role to play ensuring that we optimise the sustainability of our pharmacy practice. So going forward, we'd really like to identify the key areas of pharmacy practice where sustainability can be optimised. Obviously in the UK, we're sort of working very hard on anaesthetics and inhalers, but there's lots of other areas, particularly around deprescribing and polypharmacy and medicines optimization that align really clearly with sustainability. So we really want to develop that work. And really importantly, we want to create a bank of case studies and resources that are open to people to go in and have a look at what other people have done, share what other people have done, maybe contact people who've done those pieces of work and have those around sustainable pharmacy practice. The CSH networks have been running for some time, so we already have a huge bank of resources and information and case studies. Not many of them at the moment are pharmacy specific, but a lot of them will be relevant to pharmacy, and in many of them just the general principles of what people have learned from doing those pieces of work will apply to any sustainable QI project, so definitely worth having a look. So I'm going to stop sharing this and then I am going to go to the website and hopefully show you some of the websites that I've just mentioned. Okay. So let's try sharing again, try and make sure I go to the right page. Okay, so hopefully you're seeing the CSH main website. So this is sustainablehealthcare.org.uk. you can obviously go to all of the different sections on here, but the What We Do section talks about the principles of sustainable healthcare and kind of some additional information around those, and sort of outlines the main sort of areas of work of the CSH organisation. The SUSQI website, which is susqi.org. As I said, lots of useful information on here. This step-by-step guide is really key, and these are all free resources which will take you through the process of doing sustainable QI and provide you with all of those templates and documents that you might need to help you on that journey. For those of you working in education, there's also resources to teach sustainable QI within your organisation, and then there's a range of different initiatives that we run, the SUSQI Academy, Green Ward competitions, and that organisations can get involved in if they wish as well. And then the network site. So this is the main kind of reason for us all being here tonight. So really just wanted to show you the network site to make sure sort of everybody can find their way around. So I've obviously already signed in, but if I hadn't, it would ask me to sign in here, or if I haven't signed in, it would ask me to register. So if you're just registering with the Sustainable Healthcare Networks Hub, you send it off, and a few days later, depending on what day it is, Rachel, who does this, works Monday to Thursday. So if you register tonight, you probably won't get a response until Monday, and you'll get an email confirming that you have joined the Health Networks Hub. What you need to do then is log back in and go to the pharmacy networks. So if you click on networks, you'll get a list of all of the networks. So what I'm going to do is just show you one that I haven't joined so you can see what it looks like. So I haven't joined the Clinical Lab Sustainability Network. So I would just need to click join if that's the one that I wanted to join. So if we go back and look at the pharmacies, you can see all of the different networks are on here, and you're welcome to join as many as you wish. There's ones around operating theatres, primary care, respiratory, there's a whole range. And this is our pharmacy network. So you click on here to join the pharmacy network. I've already obviously joined it. Then within the network, there's lots of information. The stream is just the kind of the general conversation that's going on at the moment. So you'll be able to see what's been posted recently. You can read about the pharmacy network. So here you can see sort of what our aims of the network are, how we started, and who our network co-leads are. And then there's also a list of key resources here. Our events will be listed here, and then topics and resources. So these are different entries that will have been made by different people. So you can look through it that way. The other useful thing to do is to go to the resources part of the website, and this is where you can access all of the resources posted on any of the networks. If you want to comment on a network, then you need to be a member, but you can look at material on any network, whether you're a member or not. So if you go to the resources and just go to the search box, you'll see there's a little search box here, and then there's filters. So you can set up your filter how you want. So say, for example, you might just want to be looking at case studies, because you're wanting to do a piece of work yourself, and you're wanting maybe to find out case studies that people have already done. So I haven't put in any titles, so you can see we've got over 100 different case studies on here. So if I put in, for example, medicine, because we're a pharmacy and we like medicine, then it will bring up all of the results that are specific to medicine. So I'm going to just look at the 11 case studies that there are in relation to medicine. So I'll click on these two boxes, and then I can see the first one here is a piece of work done by a hospital pharmacist where she looked into how patients dispose of their medicines. So if you click on the title, what you'll find is there'll be a little summary of what that piece of work is, hopefully with sort of gives you just a quick idea of what the piece of work is and what they found. And then there may be contact details for the individuals who have undertaken that piece of work, in which case they're happy to be contacted about it. And then you'll find whatever resources are linked here. So in this case, for example, there was a poster presentation. So you can go in and you can have a look at that poster and read the details of this piece of work. So lots of really useful information in there. And so if we go down and have a look, you'll see there's a whole range of different things that have been posted. One's around inhalers from Wales, another one on inhalers. This is a whole piece of work on embedding sustainability into primary care. So a whole sort of range of different pieces of work that have been undertaken. So good to sort of have a little bit of a look around and see what's in here. And just sort of find those pieces of work that might be relevant to you. Some resources have been posted here recently around managing medicines in a heat wave, which is obviously very relevant at this particular point in time. So you can sort of play around with the different sorts of searches that there are and sort of look up what you wish. If you wish to post on the network, you go to this little plus box in the corner. And you can then post an event, a topic, or a resource. So if you go to post a resource, you can post really anything that you want here. It will ask you to sort of list what sort of resource it is that you're wanting to post, whether it's a case study or maybe it's an article from a journal. You know, maybe it's a piece of education, so you might have some slides that you want to share, or you might have read a really useful document. Could be a whole range of things. If you want a little bit more explanation on this, if you go to the About section, there's a user guide on the network hubs and on sort of uploading resources and how to define which kind of resource you have. So it's well worth having a quick look at that user guide. That opens up to a PDF, so you can see how best to post information on the network. So if we go back to this, it will just ask you then to fill in some key pieces of information. So what the title is. So think carefully about the title, because this is how people will find your work when they run searches. So think about the keywords that you might want to include within your title and that people might want to be searching on. And then you can include a summary of the piece of work that you've got. You can include a link to a website if that's relevant, or you can upload a file. So you might have a PDF or slides or a poster or whatever it might be. And then here, this is where you list which network you would like it to go on. So you can, it'll basically list all of the networks that you're a member of. So you can click pharmacy, and if you think it needs to go somewhere else as well, if it was on inhalers, you might want to post it to the respiratory network as well. So you can kind of click as many of those as you want, and it will get posted onto those networks. And then we ask you to try and define which area your piece of work or your resource is relevant to. So usually it'll be medicines, it might be something else a bit more specific. But again, this helps with the search function, so helps people to find your piece of work again. And then down here, if this is a piece of work you've just done yourself, just click not applicable. If you've done it with some CSH staff, or if you're a member of one of the CSH initiatives, then you would click it on there and then sort of which country you're submitting it from. And then you basically just save it, and it takes a few minutes and it will appear on the network, in the stream, and in whichever network you've added it to. You can also then just create a topic and just create a discussion. So if you have a question or you you want to find out a bit of information, you can do that on a topic. Again, put in the title, sort of what the key aspects that you want to know about are, and sort of post your question. And often we get that, and people sort of then chipping in with their sort of advice or guidance or information that they want to share. So lots of useful information in there to be found as well. So it's really worthwhile spending a little bit of time just having a look around the networks and sort of having a look through the different networks that we have and which ones might be relevant to your area of work. And then having a search through, again, using keywords for areas of work that you are particularly interested in. And we really, really encourage you to share your work. So people kind of say to me, oh, well, I don't want to share it because it wasn't successful. But actually, often the projects that don't work out, there's the most important learning comes from those. And that's really helpful for people to know, well, this didn't work and why we think it didn't work, and maybe what not to do next time, or what we should do next time. And also people kind of go, oh, well, it's only a really small piece of work and it was just in my department and it wasn't very big. But again, most people are starting with small pieces of work and trying to build them up. And it's so much easier to start a piece of work if you've got an example to sort of work from, and you can sort of see what somebody else has done and sort of how that's gone. So that's just a little bit of a summary. Okay, So I'm going to stop talking now, and let's see, first of all, I guess, if anybody sort of has any questions or any comments on all of that. It's kind of quite a lot of information there. I'm just going to have a quick look in the chat box and see what's been going on. Who does the email come from? That will come from, I believe it will just come from Centre for Sustainable Healthcare. So yes, that's a really good point. You might just want to look in your junk box if you haven't got the email once you've joined the network. So if you're struggling with joining the network and you haven't managed to get on after a few days, just do feel free to drop me an email and I can forward that on to our sort of networks coordinator person. Anybody got any questions? So do feel free to put your hand up if you want to ask a question or pop it in the chat box. And any of our co-leads, does anybody want to chip in or add anything? Or anybody got any experience already of posting anything on the networks? Go ahead, Roisin.
Doing the thing, and I'm feeling shamed into it now, and I'm thinking I really need to. So thank you so much for talking us through that. Nuala, I'll definitely be uploading it, even though they're small things that I've done. I will definitely upload and share. If they've any use to anybody, they're very welcome to have a look. So thanks a million.
Brilliant. Thank you. Anyone else got any questions or anything they'd like to add? Tracy.
Hi, it's not a question, but I just wanted to say that I've used the network and it's really easy to use and really easy to navigate. So thank you so much for setting it up. And I've uploaded a couple of things now and it's a really simple process. So I would encourage everybody to contribute the same way.
Brilliant, that's great. Thank you so much. Okay, what I'm going to do now, I'm going to stop recording. And what I'm going to do is pop in